Thank you very much, Catherine, for the nice introduction. Thank you to AES Health for organizing this webinar. Thank you for everybody who is watching us now. I hope we can make a nice webinar for you and answer a lot of your questions. As Catherine said already, I'm Uwe Klima. I'm from the German Heart Center in Dubai. And let's have a look what we are talking about today. Now, the question is my heart health in my hands? This is what we want to talk about today, a practical review that you do understand how complex the heart is built, how easy it is to diagnose it, and also how to treat it at the end of the day. Now, why is the heart such an important organ? It looks fairly simple, however, it is quite complex. We'll go a little bit more in details later. Now, a healthy heart has literally the size of your fist when there's no malfunction with the heart. It would beat around 100,000 times a day, pumping about 7,500 liters every day. Imagine how much this is. And if you're lucky enough to be 70 or 80 years or even older, let's say 70 years old, your heart will beat more than 2.5 billion times, which is a very impressive number. And I think this is one of the reasons why we truly have to keep our heart very healthy. Now, why is the topic important? Now, cardiovascular diseases are the most frequent cause of death in the Western world. Now, here in the Middle East, we also live a Western lifestyle, basically. So Western world is much more than just Europe, US. It affects basically most of the people on this planet here. Now, when we say cardiovascular disease, have a look at this picture here. In the middle, you see the heart, but right next to it is the great arteries, the cardiovascular system, is the lungs. So you can imagine that if you have a problem with your heart, or the other way around with your lungs or your vascular system, it's affecting each other right away. And we cannot only focus on the heart exclusively today, but we have a closer look of connecting problems here. Now, when you look at the heart overall, when you look at it from the outset, it looks rather simple, but in fact, it's a very sophisticated double pump system. Have a look now. Everything which is blue basically brings blood back to the heart after it has been used by the body. It's deoxygenated, so a lot of oxygen has been taken out. It will come from the bottom part of your body. It will come from the head part and the shoulders, and reaches then the so-called right atrium, goes through a valve into the right ventricle, and from there, as you can see, it goes into the lungs. It's oxygenated there, so oxygen is refilled, if you wish, which you need for life. And then it comes back into the left atrium. The atrium is the pre-chamber on the left side. We'll go through another valve, the mitral valve, and then it is pumped out from the left main chamber into your body. And it truly looks like this: blue blood and red blood. When you do open heart surgery, clearly deoxygenated blood is blue, oxygenated blood is red. Now, the heart itself also needs its own blood supply, which is the coronary system. These are small arteries and veins which give blood supply to the heart. And it also needs the so-called conduction system, which we're going to go into detail also a little bit more, to make sure the electrical activity is there and triggers contractions of your heart. Now, what is a sick heart? Most of you will know coronary artery disease. These are the little arteries. They give blood supply to the heart because the heart is also an organ, like your brain, like your lung. It needs blood supply on a permanently, basically, for all the time. Now, when your arteries are normal, like in the upper right corner, there's unrestricted blood supply to the heart. But when people develop coronary artery disease, you can clearly see that there is a problem in blood flow, eventually causing symptoms to you, or even worse, when this artery gets clogged, thrombus is sitting there, a plaque is breaking up, these arteries are no longer able to supply blood to your heart, and you can suffer a heart attack. I can hear someone in the background. Okay, let me continue. Now, what are the risk factors for coronary artery disease? Typically, you know, high blood pressure, cholesterol is an issue, overweight, smoking, but family history is also very important. You can live the healthiest lifestyle. However, if coronary artery disease has been handed over from your parents to you, you also have to have a close look that you don't have coronary artery disease. Gender, men are more prone to suffer from coronary artery disease than women, and age. It's clear the older you get, the more likely is that you develop a coronary artery disease. The second big group now is the heart valves. As we have spoken before, you have 4 valves in your heart, 2 basically separating the pre-chambers from the main chambers, and 2 other valves allowing blood flow only in one direction when it goes out to your main artery, to the body, and the other one when it goes to your lungs. Now, these valves are usually very delicate tissues. They open and close very smoothly, but over time they can degenerate. Calcification can occur, sclerotic changes can occur, or you can have a simple infection. A bacteria is landing on your valves, all of a sudden eating up your valves, for example. Some people have rheumatic fever. I'm sure you heard about this, especially in the developing countries. This is still a very important topic. In our part of the world, no longer, since we have easy access to the medical system and antibiotics are given when children are having fever, for example. But you can also have birth defects, born with a valve which is not working properly, and stress also contributes to early degeneration of valves. Now, valves have 2 main problems. Either they don't open up properly, then you call it a so-called stenosis, or they cannot close properly, is a so-called insufficiency, so blood goes back. The other one, the stenosis, doesn't allow it to go out in a proper way, or a combination of both. When you look here, for example, that would be your mitral valve. You can clearly see that this is the valve area which is supposed to open up for you, but in this case only a small part opens and causes major problem for the heart. We were talking about the conduction system also when I introduced the anatomy to you. Now, the conduction system is literally an electrical signal which is produced from the sinus node. The signal then goes a certain pathway through your heart to the AV node, then it goes to the septum, which is the muscular wall separating the right and left side of the heart, into the free wall of your heart. Now, the signal is important that there's a controlled and regular contraction of the heart. Now, when you look at here, for example, that's a very simple ECG. After each signal, the pre-chambers, the main chambers start contracting. And when this conduction system gets out of control for many reasons, for example, like coronary artery disease, like in a heart attack, like in valve problems, genetically triggered problems, or cardiomyopathies, so diseases of the heart muscle, these conduction systems can get out of rhythm and cause major problems. We will go a little bit more in detail in a few minutes from now. The next big group basically is the myocardial disease. Myocardium is the medical term for heart muscle. Most of the heart basically consists of heart muscle. When you look at a normal heart, as I said before, has round about the size of your fist, but there are changes in your heart muscle, like dilative cardiomyopathy, which you see in the middle, where all of a sudden the heart is ballooning. It's opening up like you blow air in a balloon. That means the efficiency of the heart to contract and to pump out the blood is limited. Or another disease is hypertrophic cardiomyopathy. The shape is still the same, but you see there's too much heart muscle there, causing problems for the main chambers to fill because there's no space, but also not enough fluid can go in there and pump it out in a proper way. Now, how can this happen? Either you have a genetic defect, you're born with it, valve lesions, we talked about the valve doesn't open, doesn't close properly, can be a reason for this. Toxicity, drug use, heavy alcohol abuse, for example, can lead to situations like this. But nowadays also infections, in particular COVID, we are very concerned about what is going to happen in the long run with patients who have symptomatic cardiac disease caused by COVID infections. Remember when we talked at the beginning about cardiovascular, you cannot only have a look at your heart, but we need to have a look also what's going on with your arteries. And typically, two main problems what we would diagnose is when you look at a normal size of a main artery here, and then have a look at the sick one, you can see clearly that the dimension has changed here. And the normal artery would be here about 2.5 to 3.5 centimeters. But when this increases in size, it's like a balloon eventually. It's prone for perforation, for bleeding, or another disease which is called a dissection. In a dissection, basically the inner layer of your artery gets a tear, opens up, and because of the high blood pressure you have in this system, the blood will create a tunnel, build a second lumen, it's called the fourth lumen, and this can be a local problem, but this dissection can go down all the way to your toes. This is potentially an extremely serious condition with a mortality of 1 to 2% every hour for the first 24 hours. So this is an absolute emergency. So dilatation, as we said, aneurysm formation, atherosclerosis, which is the degeneration of the artery, or not so important nowadays anymore, but infectious diseases like syphilis in the past caused problems like this. Congenital heart disease, and I'm really happy to share this picture with you. It's one of my favorites here. In a nutshell, basically, there's a few things which we can influence, which we cannot influence. Now, when the mother contracts an infection, measles, for example, or others, birth defects can happen. Definitely, we have control over drug use, alcohol use, smoking, blood sugar control, which is extremely important to avoid a situation where a baby is born with a congenital defect. Now, congenital disease, heart disease, is a vast spectrum of possible problems. About 5% of all children are born one way or the other with a birth defect, basically from the heart. Most of them are irrelevant or are not life-threatening. Now, the first three, for example, and now this is all abbreviations, but I'll explain to you, ASD, PFO, VSD, means nothing else that the septum, remember we said this is the wall here separating the right side from the left side of the heart, can have holes in there. Yeah? These holes are there physiologically while the baby is in mama's belly, but they're supposed to close when the baby is born. And in some people, in some children, these defects remain. That's why we typically screen babies already before they are born, but also after they are born. If they never had a screening before, it's about time to have a look that there's no situation like this. There can be others. PDA, this is a shortcut basically between your main lung artery and the main arterial system, which the baby needs as long as it is in the mama's belly. But once this is no longer the situation, this little thing needs to close here, and we can diagnose this. as well as many other conditions. Now let's go back to the different diseases we have. Coronary artery disease. Remember, your arteries have a problem of giving sufficient blood supply to your heart muscle. Everybody knows chest pain. Any emergency room series you watch on Netflix will show you some kind of chest pain. But some people also have only simple shortness of breath. Some people say, oh, I have some shoulder and arm discomfort, for example. Very unspecific symptoms, but giving us a clue that there might be something wrong with the heart, in fact. Some people have neck pain, toothache. It's not very uncommon that patients go to a dentist who says it's all good with your teeth, and the underlying cause is in fact a cardiac disease, a cardiovascular, a coronary artery disease. Some people have nausea, some people cold sweat, some people don't sleep well, for example. Again, very unspecific symptoms, but they can guide us to make sure we don't miss a coronary artery disease. Now, valve disease, similar with a few differences. People usually come, when you look under one, shortness of breath. Why? When the valve doesn't open properly or it doesn't close properly, there's a backup of fluid, of blood in your lungs, and that is what people feel then as shortness of breath. Chest pain, chest discomfort, dizziness when the valve doesn't allow a good flow reach your brain, for example. People get lightheaded, get dizzy. Fatigue is a typical symptom. People are so tired when they come home after work and say that hasn't been the case 5 years ago. Palpitations. What is palpitations? You feel irregular heartbeat. This is when the valve situation is a bad one for a long time. The heart rhythm will get involved as well. You have low and high blood pressure, so a fluctuation of your normal blood pressure. And when the fluid is basically, or the blood is backing up in your belly, people have swollen legs, for example, very typical symptoms. Or when you have an infection of your heart valve, a fever can occur. Myocardial disease. Now, the heart muscle is infected. Like you have an infection of your lung, of your liver, the heart muscle can be affected as well, since the pump in general doesn't work properly. Again, the fluid will back up, breathlessness will then occur, very typical symptoms. But the fluid can also be in your legs or in your feet, in your belly, because it will no longer flow back properly to your heart. Now, when there is overload of fluid in the lungs, people start coughing, especially when they lay flat. Generalized edema. Edema is an accumulation of fluid everywhere your buff is, swollen fingers, everywhere. People can be very tired. The heart rate can change, rapid heart rate, and in general, chest discomfort can be a symptom for myocardial disease. Now, the conduction system, remember, this is the electrical system. Your heart needs to have a normal heart rate and a normal heart rhythm. When things change here, people will feel very often irregular heartbeat. Now, the heartbeat usually is so-called sinus rhythm, tuck, tuck, tuck. But when it's out of rhythm, it's got tuck, 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 tuck. Yeah? People feel this very uncomfortable feeling, what we call palpitations. People are very tired sometimes. Dizziness can occur when the breaks between one contraction to the other, because of irregular heartbeat, gets so long that there's insufficient blood supply going to your brain. People can get dizzy. They start fainting, for example. Neurological complications can occur, like stroke. Again, shortness of breath can be a symptom, as chest discomfort, unspecific again, but it gives us a clue also that there might be something wrong with your conduction system. Now, how would we in German Heart Center diagnose your sick heart or healthy heart to rule out that it is sick? Basically, when you look at the first line, it is extremely important to take the history of a patient. How long are you sick already? What is your symptoms? How long do they last, for example? Have your parents been sick already in the past? Are your children sick? Are your brothers and sisters sick? Extremely important. Physical examination, of course. How does your lung sound? How does your heart sound? How are your legs swollen, for example? We would do basic blood tests, which are markers for the heart, but other diseases as well. And then we would always do an electrocardiogram. Remember, the electrical activity tells us a lot how the heart functions. Now, the next step is the so-called stress test. We want to know how does your heart behave and the cardiovascular system behave under stress conditions, meaning how fast is your heart rate going? Do you maintain a regular heartbeat, for example? Does your blood pressure overshoot after 2 minutes? We have to stop the investigation because the blood pressure goes through the roof. And so many other things. Does your heart muscle get enough blood supply during the stress test? So this is one of the very critical tests we would almost always do. Now, if there's any concern or we find something, we would then go for a cardiac CT scan. We want to know it clearer. Or when the heart muscle or the valves are involved, we would go for a cardiac MRI investigation. Then we are getting invasive, an angiogram where we can literally look inside to your arteries during an invasive procedure. Let's say your symptoms are different. You feel palpitations, you feel irregular heartbeat, you feel dizziness. We would typically write not only a 10-second ECG, but we want to know what is your heart rhythm doing over 24 hours, 48, 72 hours, and so on. The same for your blood pressure. When do you have a blood pressure problem? Do you have it at all? If you have it, do you have it only in the morning or 24 hours a day? So we can basically tailor make a very individualized treatment for you. And last not least, one of the investigations we do is CPET, cardiopulmonary exercise test, where we look both functions, heart and lung, especially attractive now in COVID patients when they have chronic fatigue, they have the feeling their batteries don't recharge anymore. We would do tests like a CPET. Now, what treatment options do we have? Now, we would, if possible, always start conservatively, meaning look at your lifestyle. Why do you have coronary artery disease? Because you eat the wrong thing. Your cholesterol has a problem. You're overweight. You do not exercise enough, right? Lifestyle changes are always at least part of the treatment, if maybe only the only treatment you need. Diet change is extremely important. If that is not enough, we come in with medication. We need to treat your blood pressure. We need to treat your cholesterol, for example. When we then go into invasive treatments, remember I showed you the holes in the heart of a baby. Also, adults can still have them if they have never been diagnosed, and they have to be closed eventually. Or angiogram. Angiogram, you all heard about a stent and ballooning for arteries when we need to fix your coronary arteries. Synchronization. What does that mean? When your heart rhythm is no longer a regular one, but needs to be synchronized, we can do this either with medication or, for example, defibrillation, so electrical stimulation if you wish, or you need a pacemaker. And peak of the iceberg is open heart surgery, where all these diagnostic or treatment options are no longer an option for you. Then you might need a new heart valve. You might need bypasses to fix your cardiac problem. Now, this is a picture, one of my favorite pictures of the German Heart Center. This is where we work. It has been established in 2006. I think we have a very good reputation for our patient care. We do comprehensive diagnostics and treatment for heart disease, vascular, and your lungs, all the way from top to toe, from diagnostics to the very high end of open heart surgery. Now, who are the doctors who are working for us? This is our core team, basically what you see here. All of them are internationally trained, either European or American or board certified, and we have extended our services now in general in internal medicine, pulmonology, because we do not only want to treat the heart, but if somebody has as an underlying problem diabetes, we want to make sure that we can also take care of this problem. Now, I thank you for sharing these few minutes with me. Of course, you cannot expect the impossible from us, but for anything else, please give us a call. Thank you very much.
Professor, thank you so much for your time today and for a very insightful talk for us today. We do have a couple of questions if you have time to answer. And obviously, I would ask anyone on the call, if they do have any questions, can you please write them in the text box? And please do keep your mic on mute. And if you type them to me, I will ask Professor Klima your questions. If we don't get through them today, certainly feel free to email me through and I can discuss them separately also with Professor Klima. So one question we have is, I do not have any symptoms of heart illness currently. Should I still book a consultation with a cardiologist for a physical, just to make sure all is well before I am to start a new exercise program? So doctor, if you don't mind answering that one.
I think this is an excellent question. See, nowadays we have no hesitation to drop off our car once a year for service. We want to make sure that everything is working well before we drive the car. Now, once we reach a certain age group, I think it is a must that you have a look. How good is it? Do you have any issues? A main group of patients we have basically are the ones, I call them midlife crisis group. Yeah? 45, 50 years old, haven't exercised for 10 years, and all of a sudden want to change the world, want to change themselves, and go on the treadmill, do weightlifting, things like that. For sure, you want to know that this is all good, and you have no risk, basically, to do strenuous exercises. So yes, I would recommend at least a basic investigation, a basic workup when you're 40 years and older. Then if it's all good, let's say every 5 years, if there's anything we need to follow up, we would then discuss in detail what the follow-up frequency would be.
Thank you so much, Professor. I love the midlife crisis bit. I'm one of those. We just have one other question, actually. It's quite an interesting one. Is there a direct link that you know of between COVID and heart disease as a result of the illness?
That's an excellent question too. You saw I spoke a few times about COVID. I think we are still learning every day. We are reading newly published papers every day. We have seen quite a few patients in our clinic as well. They come with chronic fatigue. All of a sudden they had, let's say, COVID in November, December, and they are still not exercising to the level where they want to see themselves or where they have been before. So yes, it is known to us now that the virus will not only sit in your lungs or in your leg muscles, but it can also directly affect the myocardium, so the heart muscle itself. This is where we would then do the so-called CPET, cardiopulmonary exercise test, to see that everything is okay for your heart or with your heart, in particular when you want to get back to normal activities again. Yeah, so when you just watch TV and have no exercise, probably a lot of people would be asymptomatic. But once you challenge yourself, you want to make sure that this COVID virus is no longer sitting in your heart muscle and causes trouble in case you do a little more exercise than just watching TV.
Thank you, Professor. I have one other question, and this is in relation to food. Professor, what would be your top foods to eat for to have a healthy heart? What would you recommend? Would you say your top 5 types of food?
Well,
Thank you.
food is a balance, basically. What we recommend is a Mediterranean diet. I am a very big fan of a balanced diet. So I'm no fan that people all of a sudden eat no more fat, eat no more proteins, no more this and that. The body needs it all, but it needs it in the right mix, basically. So what we have is a little guideline of food you have to have every day, food of what you need maybe once a week, and food what you might enjoy a lot, but you should maybe only have it every 2 or 3 weeks. This guidelines basically is the easiest way to see is called a Mediterranean diet. And there's no specific that I say only eat fruits, only eat this. It's more a basic guideline of what is healthy for you and what is needed every day and what does your body need maybe once a week only. Catherine.
Thank you, Professor. We have a question regarding leaky valve. If this is something maybe you could answer. So we've got someone who's fit and healthy. They've been told they have a leaky valve that doesn't close. Is this something that should be of concern, considering that the person is fit and healthy? Is this quite a normal thing to have?
Nowadays, with high-end ultrasound machines, we pick up even small degrees of leaking heart valves. Now, the question you asked me cannot be answered with one statement only. A heart valve can have a very mild leakage. It's like you want to close a door, but you cannot close it 100%. It won't make a big difference for you. But there are heart valves which are so sick that they leak so badly that there's uncontrolled blood flow going out, but also uncontrolled blood flow going in, that certainly needs a completely different attention than somebody who has only a small leakage. And there's the whole scope of different degrees of mild leakage all the way to severe leakage, which is then a discussion basically between your heart specialist and the patient himself. Many leakages, yes, we have. We can live a completely normal life. Other leakages start mild and get worse over time. Yes, they need to be followed up, and the right decision has to be made at the right time. So if you have a leaking valve, definitely a follow-up is highly recommended, and a close discussion or a detailed discussion with your treating cardiologist.
That's fantastic, Professor. Thank you so much. I've just one last question to ask. From what I understand, Shane Ward had an ECG 4 to 5 days before he had a fatal heart attack, but this might be just speculative. So how effective is an ECG at foreseeing an imminent threat? If that's something you could answer for us.
Yes. Remember, I showed you one slide with all the blue little dots and how we work up cardiac disease. Now, an ECG is a very, very basic but very helpful information. A so-called resting ECG is where you come, you lay down, and we take 10 seconds of your heart rhythm. It tells us a lot about your heart rhythm. Is it regular? Is it irregular? Did you have any events in the past? Did you have a heart attack, right? But the very limitation we have with an ECG, if the patient has no symptoms at that time, yeah, of course, if you have chest pain, it might look different, but let's say patient has no symptoms, is that this is under resting conditions. You might have a completely different ECG when you exercise, when we put you on the treadmill, when all of a sudden this artery, which has a blockage, works like a bottleneck in a sandwich, basically, and you have a problem with blood supply. So yes, ECG is a very powerful tool, but you need always to see the complete picture of diagnostics, which is necessary to get the proper diagnosis at the end of the day.
Thanks so much, Professor. Just another question, and I hope you don't mind talking a little bit about this. There's actually a couple of questions around alcohol and cigarettes, vaping, obviously the relationship between these and heart health, and is it possible to drink and smoke in moderation? I don't know the answer to this, but could you just maybe touch upon that a little bit, if that's okay?
Okay, good. We need to follow the guidelines of the World Health Organization. There's a certain limit of drinks the World Health Organization would tolerate or allow, however you want to see it, and it's considered to be normal. Now, it depends also what you drink. Let's say there's wines out there which are produced in a way where they do not only pick the grapes, but they also pick the little wood pieces, which are then fermented and pressed. They even have a cardioprotective effect on you. Yeah. Now, alcohol in general needs to be consumed in moderation. There's no doubt. It's not only the heart which is affected, but liver and other organs as well. Smoking, as a cardiac specialist, there's no in between. It's a black or white situation only. If you smoke, the fewer sticks you have, the better it is. But the best way is always not to smoke. There's no doubt about this one. Yeah. Now vaping, I am extremely against vaping. I know it's a new fashion for teenagers, young people, and it's so cool. Just a few vapes. Now we have seen in the literature people ending after a year or two in a situation where they end up in a lung transplant, for example. The vapes can destroy the lung tissue. We have a lot of experience over 50, 60, 70 years with smoking. However, vaping is so new, we don't know the effect of perfumes, for example, inside. All the chemicals which we have not used in the past, basically. So vaping is the worst of all, in my personal opinion here. That's it.
Okay, Professor, thanks. It seems to be very popular, particularly in this region as well. So that's some really good advice. Professor, thank you so much for your time today. Again, I know that you're very busy, and we're very grateful that you've given up your time to spend with our AES clients today. So
thank you, Catherine. It has been my absolute pleasure. Thank you very much.